My name is Dr. Smith here at Pain Consultants of East Tennessee, and today we're going to discuss some of the common conditions that we treat here, as well as some of the common interventional options that we have for those conditions. First and foremost, probably by far the most common condition that we treat here is spinal pain and pathology, most commonly being arthritis of the spine, either of the low back, mid back, or neck. Also, disc conditions such as degenerative disc disease, or maybe commonly referred to as DDD, bulging discs or herniated discs, ruptured discs. Another condition that we commonly see here would be sciatica or pinched nerve pain coming from spinal pathology. Also, we might see certain sympathetic nerve condition syndromes such as chronic regional pain syndrome, occasionally pain that's caused from shingles outbreaks that does not resolve after the initial outbreak has healed. And finally, some joint disorder conditions such as sacroiliac joint pain, and then large joint issues such as arthritis and those types of inflammatory conditions that often come with large joints. So some of the common procedures that we offer here in our surgery center at Pain Consultants of East Tennessee would commonly include things like epidural steroid injections. Sometimes we offer a targeted approach to those that you may have heard of, referred to as transforaminal epidural steroids, or TFEs. Oftentimes we can use a midline approach, which is commonly just called an ESI, or epidural steroid injection. Sometimes an approach down near the tailbone, just depending on where the pathology is and what the target is, as well as other factors that may come into play based on a patient's specific anatomy and prior surgical history. Also, for arthritis conditions, we offer things like radiofrequency ablations or treatment of the nerves to the painful joint supply of the spine that can provide long-lasting relief without the need for steroids. Thirdly, another procedural option that we offer for certain nerve conditions, things like sympathetic output overactivity, would be sympathetic nerve blocks for painful conditions like chronic regional pain syndrome or specific conditions like that that affect the extremities, either the arms or the legs, or sometimes for shingles pain as well as neuropathy type syndromes. A couple of other specific therapies for more specific types of injuries or pathology would be a procedure called Kyphoplasty, which is offered for compression fractures or specific traumatic injuries to part of the vertebral bodies or the bony structures of the spine itself. We do offer an interventional approach to some forms of spinal stenosis, depending on the specific patient and their symptoms. And lastly, we offer various forms of neuromodulation or spinal cord stimulation, which can be a very exciting approach for patients seeking long-term alternative treatments to pain where surgery may have not been successful or isn't an option. And there are a couple of different options to pursue as far as neuromodulation, and it's a really evolving field right now in interventional pain management, and we're excited to offer that procedure option to some of our patients as well.